You know, in medicine, there are some things you just assume are settled, right? Foundational ideas that have been in the textbooks for generations. But what happens when we find out that a system doctors have relied on for over 70 years is actually missing a couple of crucial pieces? Well, that's what we're going to get into today. It all really starts with this one fascinating question. What if a nerve that stopped working isn't actually broken? What if it's just sleeping, basically put on hold, waiting for someone to flip the power back on? This one idea is at the very heart of a medical puzzle that's been stumping doctors for decades.
So, for the better part of a century, surgeons have been working with this classification system for nerve damage. And it was brilliant for its time, but it had this blind spot. There was this whole group of patients that just didn't fit the mold.
Okay, so picture this. A patient comes in with a classic case of foot drop. They literally can't lift the front part of their foot. The weakness is obvious, it's debilitating. But when doctors run all the standard electrical tests on the nerve, the results come back completely normal. On paper, the nerve looks perfectly fine, but in the real world, it's just not working.
And this quote right here, it really gets to the human cost of that gap in our understanding. These patients with very real problems were often just sent home. I mean, you can't blame surgeons for being hesitant to operate when there's no hard evidence, no proof of an injury. So what in the world was going on?
To really get what a big deal this update is, we first have to look at the classic map doctors were using. And this is the blueprint that has guided nerve surgery for more than 70 years.
It all kicked off way back in 1942 with a guy named Dr. Seddon. He gave us 3 basic buckets for nerve injury. Then, in 1951, Dr. Sunderland, an anatomist, really fleshed it out into 5 grades of severity. And honestly, that's pretty much been the gold standard. Until now, when this new team of researchers came along and said, hey, we're missing 2 crucial categories.
So to make all of this make sense, let's just use one simple analogy for the whole explainer. Think of a nerve, one of the ones in your arms or legs, as a really sophisticated electrical cable. Inside that main cable, you've got thousands of tiny little wires called axons, and each one has its own insulation. Damage can happen to just the insulation, to the wires themselves, or to the whole shebang. And that brings us right back to our mystery, the patient with totally normal tests. The researchers actually started calling this the Sleeping Beauty problem, and they found the absolute perfect case study to show us why.
So yeah, this story is about a 55-year-old woman who, after a bad car accident, had a recovery so fast it just looked like a miracle.
All right, let's just break down the facts here, because they're pretty wild. She has a crush injury to her arm. For 2 years, she's dealing with pain and weakness. But every single one of her nerve tests, totally normal. Despite having no proof, surgeons decide to operate anyway, just to relieve pressure on the nerve. And get this, just 2 days later, her strength is way better and her pain is way down. How is a recovery that fast even possible?
And this is the big reveal. This case is the perfect illustration of the first huge update, Sunderland Grade 0. The technical term is an ischemic block. What that means is, it's not damage to the nerve structure at all. It's a blood flow problem. The nerve is literally being starved of oxygen, putting it in a state of suspended animation. So in our analogy, the cable and all the little wires are perfectly fine, but the power cord is unplugged. And that's why the tests were normal. They were testing the wire, not the power.
You can see it right here on this new chart. For a grade 0 injury, recovery can be almost immediate once that compression is released. You restore the blood flow, you plug the power cord back in, and the nerve just wakes up, just like that patient who is better in 2 days. It wasn't a miracle, it was a grade 0 injury that we finally have a name for.
Okay, so now that we've found that missing first rung on the ladder, let's quickly climb up the rest of it and see how the physical damage to the nerve gets worse and worse.
And when you look at a cross-section like this, you can really see that cable analogy come to life. The whole nerve is made up of all these smaller bundles, or fascicles, and each one is packed with thousands of those tiny axon wires.
So grade I is like the insulation on the wires just gets bruised. It slows the signal down, but it usually recovers on its own. Now in grades 2 and 3, some of the actual wires inside are broken, but the main cable structure is still holding everything together. By the time you get to grades 4 and 5, though, we're talking catastrophic failure. The entire cable is either scarred so badly that nothing's getting through, or it's just been completely cut.
But for those middle ground injuries, where some of the wires are broken, how can doctors possibly predict if it'll get better? Well, sometimes the answer comes down to finding just one tiny electrical signal.
This quote here reveals something so cool. It's talking about a MUAP, which is short for motor unit action potential. Just think of it as the tiny electrical spark that proves a nerve is successfully telling a muscle what to do. And for a grade 2 injury, the research shows that if doctors can find even one of these sparks on a test at the 3-month mark, that is a powerful, powerful sign. It means there are enough healthy wires left to sprout new connections and lead to a full recovery, all on their own. One tiny signal can totally change the plan.
So we have the sleeping nerve, and we have this ladder of increasing damage. But let's be honest, real-world injuries are rarely that neat and tidy, right?
And here it is, the second big aha moment. A real injury, say from a bad fracture, isn't just one type of damage. If you look at this diagram, you can see how in a single nerve, one bundle of wires might be completely severed. That's a grade 5. The bundle right next to it might just have some bruised insulation, a grade I, and maybe another one is being starved of blood, a grade 0. This messy, mixed-up real-world situation, that is the final piece of the puzzle, Sunderland grade VI.
So why does all this matter? Why is adding a sleeping nerve and a mixed-up injury to the blueprint so important? Well, it's pretty simple. A better map leads to a better destination.
This complete table, this is the payoff. It's a much more accurate guide. For the first time, surgeons can really look at a patient's symptoms, look at their tests, and place them on this spectrum. It helps them answer those huge questions. Should we wait and see? Should we just do a simple surgery to free up the nerve? Or do we need to go in for a complex repair with grafts?
And at the end of the day, here's what it all means for patients. It means getting an accurate diagnosis, especially for those people who were told for years that nothing was wrong. It means a more realistic prediction for recovery. It guides surgeons to a more tailored, more effective treatment plan. And all of that leads to the one thing that truly matters: better outcomes and getting your life back.
You know, it's just such a powerful reminder that science is never really settled. That 70-year-old system wasn't wrong, it was just incomplete. And it really makes you wonder, as our technology and our understanding get better and better, what other fundamental rules of medicine are just sitting there, waiting for someone to come along and write the next chapter?